talk a little bit about this?
I forgot one big thing, actually. I'm a bit nervous as well. I wasn't happy because when after the rapid expander did its thing, I felt that this bone of my nose is pulling out. I felt pain.
Which one? The
This
side
one.
or
This
the front?
one, yeah.
Where about on
And
the
the
top or all sides?
Both. This
Okay.
and this. And it was weird because I was really aware of the way that I looked like. I was 16.
16, you're a girl.
Yeah, I had a boyfriend. Everything was fine. So I knew. To be honest, I was okay with the way that I looked. Okay, even though it wasn't perfect, but I was really aware of where everything is at. Then I noticed it was after the surgery of the canine, like after I got the big
The big event.
yeah. And then I started to realize that this bone is showing up. And I don't know, back then I didn't didn't connect the two things, like this is that, I had no idea, but I accepted that.
Mm-hmm.
I never said anything to my doctor because I was embarrassed. I never said anything to my parents because I was embarrassed. I told my brother because we were really close, and I remember one night I was like, what is this? And he wasn't there before. And he remembers that, so yeah. So
and
overall,
you felt that was related, looking back on it now, you felt that was related to the surgery or to the expansion?
not to the expansion. Now,
Okay.
when I look at this now, and when I see pictures of the actual maxilla, I had no idea. I can see that these bones are, this is connected. So I realized that maybe this was the case. And today, when I've started to think to maybe fix some things in my face, make it look better, because now I can understand. Now I see this is asymmetrical. I'm not satisfied with my smile. My nose is bothering me still. I saw a plastic surgeon for a nose job, and I saw orthodontist for my upper maxilla, and they said that there is a big chances that this is connected. They said that obviously my nasal spine is behind, makes my nose appear bigger. That's what they said.
Okay.
And
then did you have work done on your nose?
I had a non-surgical surgery.
Okay.
Yeah, with hyaluronic acid. Just to change the tip a little bit. Now it's almost faded, it's faded 90%. But the main goal, he was like, are you wearing glasses? It was strange for him that this...
So this is when you suggested to your orthodontist that you felt there'd been some change in your nasal area?
I never told him anything.
You never told him?
I never told him anything because I thought I was a little bit depressed because I wasn't,
You were a young girl.
I was young, yeah.
You were concerned with the result of the orthodontics?
Yeah.
You're concerned with the fact it might have impacted your nose? Okay.
Yeah. I never said anything. So it's just for the recent 2 years, it is comfortable for me to talk about it and to share it with people.
So carry on. So where the orthodontics then comes to a conclusion, you get retainer.
Retainers?
Retainers. Do you have some retainers to wear? Some braces? You've got wires behind the teeth, or you've got braces
I have
to wear?
this wire in here.
Okay. So we just
And he gave me.
Cool.
Oh,
Very
yeah.
keen. I don't want the no identities to be shown.
Sorry. Pull it out in advance, and I forgot about it. There it
Okay,
is.
so
He
you
gave me
have that
this at the end
retainer.
of the treatment. I had to go.
Did you have a wire put behind the bottom front tooth?
Yes.
Yeah, because I'm
In here.
noticing that on the models.
Still on.
It's still on. You don't wear the upper one anymore,
Oh no, he told me that I should wear it for 2 years
and then stop.
and then stop. Yeah.
Did you do that?
It was uncomfortable. I tried, and it was painful as well.
Okay. So you stopped wearing it. How long?
A few months.
Okay. So you got a few months out of that. But you still clearly have the lower wire in place.
Yeah, I have.
Now, okay, so what are your concerns now? Do you have other concerns, or you just, you felt you've been left with a bit of an asymmetric result?
Yeah, I've been left with asymmetric results.
But then you had an asymmetric result. I would imagine if you had a canine that impacted with that arrangement of teeth, which is asymmetric in itself, I would imagine you probably had some facial asymmetry to start with.
Right. When I look at pictures when I was young, yeah.
Yeah.
It was.
Okay. Okay. So what's your beef? What's your annoyance? Because clearly, I'm very keen to be fair. I want to find out what problems occur. Partly by interviewing people. Clearly, the orthodontist has a lot of good results. You weren't his good results.
No.
But that's going to happen, isn't it?
Yeah.
We're going to get ones that don't work.
Yeah.
Everyone. I mean, this is what I focus on. My challenge to me is to make certain that every single child gets a good result.
Yeah.
Because if I can get every child a good result, it's focusing on the few where it doesn't go easily. That's where you learn from. That's where you'll get better. Not from focusing on the ones that go flyingly well. Yeah, they look good on the pictures. They look good on the wall. I've got some great cases downstairs.
Amazing.
Yeah, well, as I say, I hope the best in the world. But as I say, anyone challenge me. What's your beef?
I think it's really important to create an awareness within parents.
That? What awareness?
First of all, whenever you are aware of something, you take a better look, and you go to see doctors, the right doctors, from a young age. Even if everything is amazing and you have the most beautiful child in the world, okay, I think it's really important to see. And within the bite, I didn't bite correctly from day one.
Yeah. But a lot of this, I think, could almost be attributed down to the fact that you didn't have an early diagnosis.
Right.
You had a very late diagnosis.
I know.
And had you had that, and that's not really, we can't really blame that on the door of the orthodontist. I mean, that tooth, the impaction on that tooth, that's pretty severe. The tip of the tooth is crossing the midline. That's a tough one to resolve.
Okay, so basically what I'm trying to say is just be aware of the signals, the signs. I had the diction problem.
Diction as in speaking?
In speaking, yeah.
Yeah, because you think, why do you think, I don't want to put any words into your head, why do you think you had a diction problem?
Because whenever I said words with S,
yes,
in Hebrew there is a
lot of words.
Yeah, tzaddik. So whenever you say tzaddik, stuff with tza, okay, it goes, to this way. Z as well, and when I ask now my mama why you never told me, she said, I thought you were speaking like that because you were a bit spoiled or whatever, stuff like that. But it wasn't the case. I'm not spoiled. Not spoiled. But so I think it's really important to take a look, an overlook of your child from day one, And I wasn't swallowing correctly, and I think now that I take a look at myself in the mirror while I'm swallowing, this is weird.
Okay.
It doesn't look good.
You mentioned, when you contacted me, you mentioned that you see yourself in a lot of the videos that I have presented. Do you want to elaborate a little bit, sort of explain a little bit what you mean by that?
Okay. You and your father, you have many videos.
Yeah.
I think I watched all of them, and I can see myself nearly in every single video. And it's from whenever you speak about asymmetrical face, obviously. Whenever you speak about teeth pulling. Whenever you speak about the lips shapes, chin, everything. Yeah, I can see myself in every video.
So, your take-home message to people is it's trying to spot these problems earlier?
Yes, definitely.
And I don't think we can really take away from this that the orthodontist caused you great issues, because I think he was doing what he was taught to do.
Yes.
Yeah. You were an extremely difficult case that was diagnosed late. You know, a case where you're missing an upper tooth, it is difficult. Yeah. Do you think it was a mistake to take teeth out?
Yes.
Why do you think that?
Because they were healthy. I don't think that there is a point to pull healthy teeth out.
But you see, the thing is, you now have your wisdom teeth. I mean, they don't look completely in function. I mean, actually, no, they're not too bad. I would imagine they've come down okay since then.
Yeah, at least that I have them.
Yeah, they seem to be.
Them.
You kept your wisdom teeth, so you know. In reality, an orthodontist can say, "Well, we just swapped your teeth."
I know. And
we took the front
it.
one out, and we're giving you a back teeth, because this is saying that most people in the modern world don't get their wisdom teeth in.
Right.
It's almost become accepted that we don't have our wisdom teeth. I think that's a shame, because, well, all our ancestors had their wisdom teeth.
All right.
So why don't we have our wisdom teeth? But that's accepted they don't, and in your situation you have got your wisdom teeth. So you're in a better situation from that point.
Yeah, but after all I've been through, as I was saying about the missing canine, open a space, now I know that these 3 teeth that I have, front teeth, are basically dead, considered dead. They don't react to...
they don't react to...
Yeah.
I mean, it's difficult. It's difficult on the x-rays we have here.
I have
to really
these.
see the root lengths. You've got some...
Yeah, this is also recent.
These are recent. Okay, so if we look at these... Yes, okay.
And they think that this is because of the, they got...
Well,
they moved
there's
back
gross,
and forth.
yeah, there's gross damage to the roots of these teeth.
Yeah, and they cannot...
Now, can you pass me the original x-ray that's underneath?
First one, there you go.
So, if we look at this, this canine, although the canine is crossing the midline, I can see the outline of the roots, and you had good root length at this point. So the canine wasn't causing any damage to the teeth, all right? But you have gross damage to the roots of those
and
teeth.
my gums are sitting over here.
Lift up. Oh, yes, dramatically. Yeah, I mean, that's halfway up the tooth.
And they said because it was a reaction of them moving back and forth. This is what they say.
Yeah, well... Yeah, I can imagine that the rapid maxillary expansion, which moved everything outwards, potentially out of the balance zone, may have contributed to it.
Yeah.
Although clearly you brought it back again, but it's. Yeah. So so we can agree that you have had some damage from this orthodontics. You've had notable damage, and of course these are your front upper teeth.
Yeah.
They're damaged. And particularly that tooth number 4 that's pretending to be a tooth number 3, it's standing in the roll.
That's what I said.
That is not going to, I don't think that will last you out.
I know. It's dead. And they cannot treat it like the roots. They cannot, because they say 99.9 you're gonna lose this tooth. So you're gonna have to put like an implant.
Well, you need to be careful on that front, because when you get the type of bone loss you've had there, you will probably need bone added before you can have an implant. It depends on the situation.
I checked that as well. I had a gum doctor checking my
so a little. Okay, so he took like a little 3-dimensional scan.
Yeah, and he says that the bone is okay.
Okay, good. Okay.
No, it's okay. I asked because at least that if I'm gonna lose the tooth, I'm gonna.
Yeah. So I think what we're looking here is an unfortunate situation. You don't have jaw joint problems, and you don't have other issues. You've seen my videos. You've seen how I'm trying to bring in other issues together. What do you feel?
I do have joint problems. On this side, on the left side.
Cool. And I'm not putting words in your mouth.
No. I'm sorry, because I forgot. I should have made a list.
Well, but clearly, I've made a point, Daniel, of not trying to have, not looking at any of your material before we started talking.
It's pretty obvious, unfortunately, because you can see it whenever I open my mouth wide. You can see it. It's like it has like a little, twist, jump.
Yeah.
You can see.
Well, you've got quite asymmetry.
I know. So I got this on here, and whenever I get like treatments, and if it's open for like a few minutes, whenever I close it, it's like really painful, and it's like you can see if I.
Yes.
So it's like jumping.
Yeah, I can see it jumping. Well, I do also notice you've got significant markings on the side of your tongue.
Marking?
So there's marks on the side of your tongue where your tongue clearly is slipping in between your teeth at rest.
That is correct.
So we would call this scalloping. And so I think your tongue's splinting. So you rest with your tongue slightly between the teeth.
That is correct.
When I've been watching you swallowing, when you're swallowing, you're activating the musculature around here. Now, I do that to some degree, but you're just doing it more, and your tongue's coming between your teeth, and then you bite on your tongue when you come to it. So you're not using your cheek muscles to a great extent when you swallow. A little bit, but not a great extent. You're then biting on the sides of your tongue, and consequently you leave your teeth open a little bit all the time.
A little bit. My teeth.
Teeth.
Yeah. When I'm sleeping, my lips not so much. My lips
No. I think your lips are together.
While I'm
together
sleeping
most
as well.
of the time.
They're together.
I still think your lips are apart more than you think they are.
Sorry?
I think your lips are apart more than you think you are. Take a moment, watch this video when it comes out, and watch how you rest. And I think you'll notice that sometimes you do this. I've done it a couple of times while I've been talking to you.
Okay.
And that's usually an indication of where you would rest naturally. In the same way that when you're with your parents, you watch your language. And you don't have to think about this, you automatically don't swear. When I'm with my friends, I'll let I'll use it. Occasionally I'll use some more colourful language that I just wouldn't if I was with parents or professional people. And clearly there's little triggers that go off on my mind that set that up. Now, you're sitting in front of me. You're on camera.
Yeah.
You're going to be trying to keep your lips together more than you would normally because those triggers have been switched. But when you're thinking and your mind's off somewhere else, I'm watching you.
Okay.
Do you see what I mean?
Yeah.
And that's displaying subconscious habits that are giving me the impression that at least for an element of the time, your downtime, your relaxed time, your habitational moments, you've got your lips apart. I think a little bit more than you think. Now, that aside, for quite a lot of the time, I suspect that you rest with your teeth apart about 2 to 3 millimeters, with your tongue almost all the way around. Almost the whole way around. This is, in a way, what's kept your teeth in the position they're in. You've not been wearing your upper retainer. So something is holding not just the lower retainer, or that can help, but something's helping to hold your teeth in a reasonable alignment. Yeah. So your tongue is slightly...
Yeah, I know.
That means you hold your teeth open a little bit. Now, if you hold your teeth apart a little bit, then the jaw joint is going to reform in a position where the teeth are apart a little bit.
To this side, maybe.
Well, the jaw joint's going to reform to wherever you rest. Because that's what happens. All the information you give to the jaw joint is going to be information determining where it should be. It should be. The body is picking up from your rest position where it should organise the joint and the muscles and all the ligaments to be organised too.
Okay.
Cool? Now, that position is with a certain amount of opening, an unnaturally large amount of opening. When you put your teeth together, the jaw joint is then in a further up and back position. So it's almost like the jaw is over-closing when you bite together. And as it closes, it's closing a little bit further than it normally would. So the idea is the jaw joint is formed so it's in a balanced position within the joint, but that forms when you're at rest. When you bite together, the jaw joint's got to go further back and up. Now, clearly this is a clever joint. It's a clever joint. It has an opening component, rotational, and it has a sliding component. You can push your jaw forward. Now, to allow those two components, it has a disc in the middle of it. So one half of the disc does rotational, the other half of the disc does rotational. Now, when you overclose, there's no space for the disc. So the disc gets squeezed out. Then when you open, you have to jump back onto the disc. When you close, the disc gets squeezed out, and that's why you're getting that click-click. See?
Yeah.
Now, the reason your tongue is sitting between your teeth is because you want some of the volume of the tongue out of your airway. Your upper jaw isn't big enough, both this way, because it's relatively narrow, and also this way, where you've had teeth taken out.
Yeah.
Okay, it was your premolars and you've got your wisdom teeth, but you still don't have 32 teeth in your mouth, plus the space behind it. So your tongue volume is reduced. Also, I mean, you have relatively good facial structure, alright? But still, your whole tongue volume is set back and down towards your airway. So you've got a slight forward head posture. Your shoulders are slightly rounded as you maintain an open
one
airway.
Of them is like,
you've got certain asymmetries. I've not done an examination on you. We sat down here. I've not done anything. I hope that I've not said it wrong, you know. So you're doing some compensatory mechanisms, habits, to maintain a comfortable airway, because the most important thing in your life is
breathing.
So, to breathe comfortably, you hold your head slightly forward. You also put your tongue slightly between your teeth. Because your tongue is slightly between your teeth all the time, your jaw joints reform to that position. When you bite together, you squeeze the disc out of the joint, and that's why you get that click.
Okay. So is it like on one side because of what?
You're asymmetric.
Okay.
Okay? Now, I'd need to do a deep examination before I start being led on asymmetry. Asymmetries annoy me. One day I'm going to
Me too.
Well, one day I'm going to take a sabbatical. I'm going to sit down for 6 months with some books and some skulls, and I'm going to really get my head around asymmetries. It needs doing, but I need that absolute focus to get my head completely around asymmetries. At the moment, they're annoying because they're just so complex. I mean, I trained under Professor Melson, who was interested in asymmetries, and while I learnt a lot, it was very much static. It was just how things were. It wasn't how that had happened. And so, clearly, I don't see people being born asymmetric. I mean, it does happen, but I tend to see them becoming more symmetric.
Okay.
As a tendency, not always.